the Deputy Chief Medical Officer, Dr Nick Coatsworth. Nick is a specialist in respiratory conditions and infectious diseases and is overseeing Australia's ventilator expansion program within the hospital system and the ICU. Also joined in particular by Michael Roth, the CEO of the Australian Private Hospitals Association. One of our great tasks as we, on the one hand, contain the spread of coronavirus and flatten the curve, that's our great first task, but our second task is to boost the capacity of our hospitals to deal with this outbreak, to provide the support for our patients, to guarantee that we can fight to protect every life of every Australian. Today is about, in particular, securing and expanding that capacity. A partnership between the Australian government, the states and the private hospitals that will bring over 30,000 beds within the hospital system into an integrated partnership between the Commonwealth and the states and the private hospital sector. It will bring over 105,000 full and part-time hospital staff, including 57,000 of our amazing nurses and midwives. It guarantees them their future and their support both during the crisis and beyond, but most importantly, it brings their resources to the fight against coronavirus, COVID-19 in Australia. So to put all of this in context, as I mentioned, our task is twofold. First, to help contain the spread of coronavirus. And I think it's important to begin with the latest news. As of 6 a.m. this morning and the report to the National Incident Centre, there were 4,359 cases. They are being updated during the course of the day by individual states, and we'll provide this evening an updated figure. Sadly, we now have 19 lives lost. One of the things which we would also mention is the number of cases in intensive care and those on ventilators. We have currently, on the latest advice available to me, 50 cases in intensive care and 20 cases on ventilators. What those figures show, coupled with the fact that now with well over 230,000 tests completed, we have what we would regard as a reflective picture of the numbers in Australia. That if the lives lost, and each one is an agonising loss, are below 1%, then that is indicative that the testing regime is capturing the significant reflective data for the country. If those within ICUs, and in particular within ventilators, are in the low numbers that we see, and all of these numbers we know will climb, but they are reflective again of the numbers, and it presents a very different picture to some other countries where the lives lost represent not 0.5%, but 10% of the cases. It means that the case numbers there are not fully reflective of the situation. So by having what we believe is the broadest and widest testing program in the world, perhaps only Singapore and Korea, but at this stage our numbers indicate that we are at the global forefront, we have a good picture of where we're at. All of this is then being backed by the social measures, and these most difficult of social measures are about saying, whilst we are making progress and whilst we are now flattening the curve in the first early stages of progress, there's more to do. We were at 25 to 30% growth just over a week ago on a daily basis. Now we have come down in the last week to the low teens, and the latest advice I have from the National Incident Centre this morning is that the last 3 days have been approximately 9% on average. That's an achievement to which all Australians have contributed. And I want to say in these most difficult of times, with these most difficult of measures, that none of us had ever dreamt we would ever be involved in, you have risen to the occasion. To those Australians who are at home, to those Australians who are isolating or in quarantine, I want to say thank you. Your actions are making a difference and saving lives. This progress is early, it's significant, but now with these additional rules around gatherings and movement, we are going the next step to help reduce again the level of infection and to support our containment. All of that is then backed by our attempts and our plans and the reality of improving capacity. Today, we make a very significant stride in improving capacity. 2 days ago, we announced universal telehealth for Australians. In other words, we rebuilt Medicare over the course of the last 10 days. Now we have over 1 million telehealth consultations that have been completed. That's protecting doctors and nurses and protecting patients and providing access where otherwise it might not exist. The second great element in the reconstruction of the Australian medical system is reconstructing the relationship between public and private hospitals. The partnership between the Australian government, the states and the private hospital system will deliver additional capacity for the Australian system. It does that in return for the viability of the private hospital sector throughout the course of the COVID-19 epidemic, this pandemic that the world knows, and it does it in such a way that the hospitals will be available and their staff will be available to participate fully in our national response and to be able to bounce out and to support the needs of the population after we emerge from the period of coronavirus. We will be guaranteeing the viability, along with the states, of all 657 private hospitals in Australia, and we're doing this with a Commonwealth guarantee, then state partnerships, and then the individual private hospitals relying on the source income that they have from their ordinary operations. Those three things together will mean that our hospitals will be able to continue. An important part of this is that in return for our guarantee, there's a guarantee of flexibility, capacity, participation and staff retention from the private hospitals. The Private Hospitals Association has committed to that. Their membership has committed to that. The Day Hospitals Association has committed to that. Catholic Health Australia has committed to that. And we've had support from our magnificent doctors and nurses with the Council of the Presidents of Medical Colleges on behalf of all of our doctors supporting this and being part of the statement, and the Australian Nursing and Midwifery Federation has also signed on, and Annie Butler will be making statements from Victoria. She recently returned from overseas, and as Secretary of the National Federation, she'll be speaking from home because she's doing the right thing and practising isolation for the time being. In terms of the capacity, it means over 34,000 beds and chairs that will be made available to the public hospital system. A third of intensive care units are within the private hospital system and will be made available. Over 105,000 full and part-time staff, including over 57,000 full and part-time nursing staff. The activities are broad and they will work together. The hospitals have committed to be fully flexible. They may be taking public hospital services. They will be making their ICUs available. They may see an exchange of staff or equipment in either direction. They may be providing support services for patients who are coming from aged care homes or other areas where there may be need for isolation or quarantine. They may set up in the day hospitals flu clinics. They may set up in other day hospitals testing clinics. They have committed to be flexible in a way that has been beyond conception. And what this agreement does is it dramatically expands the capacity of the Australian hospital system at the same time as we are bringing down the numbers of what could have been the case, or, as Australians know, the process of flattening the curve.